Hi everyone, Dr. Suneel, Dhand, internal medicine physician. Welcome to another video. I know I talk a lot about how I absolutely do not trust doctors. I don't want to go anywhere near a doctor, even though I'm a doctor myself. I trust myself, but I have zero interest in any other medical interaction. And I want to dive into that sentiment a little bit more in this video. But first I want to share with you a clip of the great Dana White and his thoughts on doctors.
I'll never talk to a doctor about my general health ever again. If I break my arm, I'm gonna go see a doctor. If I need surgery, I'm gonna go see a doctor. My general health, never again. None of them know what they're talking about. They're all full of shit. All they know is to put you on pills and put you on medicine. That's all they know.
So I would like to say first and foremost that I completely concur with Dana White in that video. I agree. I feel the same way. I have no interest whatsoever in any healthcare interaction, especially when it comes to health and well-being, maintaining health, preventive medicine. No, thank you. Absolutely not. Of course, nobody is arguing that if there was an emergency, you would need to see a doctor. I work in that field myself, in acute care hospital medicine. Obviously, if there's a very serious condition, if you're dealing with infection, sepsis, whether it's a traumatic injury, broken bone, as Dana White said, nobody's arguing that you would want to go and see a doctor. It is with everything else that the problems arise. And I truly don't think that members of the medical profession, the hundreds of thousands of doctors out there in countries like the United States and United Kingdom, realize they don't have the time to take a step back. Now, I'm not criticizing every single doctor. I think there are some very good doctors out there. There are lots of very bad doctors, but there are some very good doctors. And they don't even realize how collectively broken their minds have become, absolutely broken to pieces in the current medical paradigm, which is all about prescribe, prescribe, prescribe. Oh, you see a patient coming through the door, your prescription pad is half out, wanting to be written on or typed these days to give a medication, a chemical to put into the body. This paradigm is completely and utterly broken, and we are going to realize it one day. Doctors nowadays, when they go through medical school and they receive all the propaganda training, they are not taught to think in terms of root causes. It is very easy to pull the wool over the eyes of any practicing physician, whether that's by the Physician Society or the Medical Journal, who is absolutely loaded up with conflicts of interest and financial motivations to prescribe, prescribe, prescribe. Doctors at the front lines are merely pawns in this whole process. And I don't think doctors, by any stretch of the imagination, are blameless here. How on earth did the medical profession, how did the minds of doctors become so broken, where they think that the answer to everything is to pour chemicals into people, never look at root causes, never think about true health and well-being? And that is why I completely agree with Dana White. You see, up until relatively recently, doctors were much more in tune with real health and well-being before the medical profession got completely bought out. A few decades ago, you would go to a doctor and they'd say, look, what's going on? Go on a holiday, get outdoors, eat in a common sense way. What you're eating now is unacceptable. I remember when I was young, a child, wasn't that long ago, doctors were full of that type of advice. Nowadays, oh no, absolutely not. Here's a pill, here's an injection. And the ironic thing is that we've always known this in medicine up until relatively recently. Hippocrates, the father of medicine, 2,500 years ago, if you read what he wrote, he was all about looking at the true root causes of illness and how the true health of anybody is rooted primarily in what they eat. And even 100 years ago, if you were diagnosed with type 2 diabetes, you would have a far greater chance of reversing it successfully, because a doctor would be very blunt with you and tell you that you absolutely have to make changes. Now it's all about medications, while your illness keeps getting worse, whether it's type 2 diabetes or any other type of inflammatory illness. Doctors want to prescribe their chemicals. And feeding yourself into the medical industrial complex, that is what happens. And this whole line from the medical establishment, from doctors, oh, we can't do anything about the problems of society and what people are eating. What a whole load of nonsense, a whole load of tosh. As I said recently, 3 years ago, the medical establishment could bring the whole world to a standstill over a disease which was a common cold in most people. Actually, most people had no symptoms whatsoever. They could do that, and you're telling me that they can't, if they wanted to, do something about the toxic environment that most people live in these days. They could do something about the way food corporations work and operate. They could do something in terms of promoting a big public health message. Of course they could do that, but they have no interest in doing that because there's no profit involved. So coming back then to what Dana White said in that video, if you feel the same way as me, well, what to do? I have no interest whatsoever in registering with a primary care doctor. As I've said many times, I've never done that because I know what would happen. If I registered with a primary care doctor, firstly, they would barely look at me. I wouldn't tell them I'm a doctor so that I could observe their behavior. They're quite overwhelmed with bureaucracy. They would be looking at their screen, checking off their tick boxes. They would ask me if I've had this injection, that injection, and then they would wave goodbye to me, having barely looked at me and asked me about my real health and well-being. What on earth is the point of that? So enough about talking about this problem. What would I actually do if I was in charge to try to change the situation? Well, I can think of 3 points here. Number one, a complete revamp of basic medical education, particularly in medical school, where medical students barely receive any education whatsoever on health, nutrition, and true well-being. Understanding the true determinants of baseline health, namely the fact that what you put into your body is paramount. Medical students need to understand this, and they really need to understand the difference between real food and fake food. They need to understand basic concepts in terms of what people should be eating and what they shouldn't be eating, to the point where when they meet someone, that should be one of the first things they ask, so that the patient gets it into their head that their doctor expects them to be eating real food, to be avoiding all of the bad food. I mean, I could talk for a long time. I could do a 3-hour lecture on my thoughts on the complete farce at the front lines of medicine these days. What cardiologists tell their patients in the hospital, what oncologists tell their patients in the hospital, gastroenterologists. There's no emphasis at all, or very little emphasis, on what people are eating. I mean, think about this. Most oncologists out there will meet a newly diagnosed cancer patient with a decent chance of survival, and they won't even touch upon what they should be eating. I mean, this is basic stuff. What you are putting into your body, if you want to optimize your metabolism, if you really want to beat a tragic illness, then this has to be talked about, and it is basic common sense. I've heard a lot of stories from people who tell me that their oncologists tell them that they can eat whatever they want. I'm not talking about tragic end-stage disease where obviously if someone has a limited lifespan, they can eat whatever they want, enjoy whatever they want. I'm talking about a newly diagnosed cancer patient with a decent chance of survival, not even receiving a discussion for even 30 seconds on the ideal foods to put into their bodies. Real foods, maximize proteins, antioxidants, cut back on those terrible processed foods, sugars, corn syrups, limit refined carbohydrates. All of these things are very basic discussions and they don't go on. Number two, I would be a lot more strict with conflicts of interest, which are absolutely everywhere in healthcare and medicine, whether we're talking about medical journals, whether we're talking about healthcare, medical institutions, organizations. And I would want every physician to have openly declared what their conflicts are. Who has given them any money? Have they received any money from pharmaceutical companies, other big business interests? And this should be displayed on the doctor's website. And also, if we're talking about a hospital or a clinic, there should be a pamphlet with all of these conflicts listed clearly. I'm not talking about some obscure website. They should be there so that every single patient can see who is funding my doctor, and is there any other reason for what is being recommended to me. I would extend this as well to the healthcare institution, particularly any university. Let people know, let all your patients know where the money is coming from, and let this be openly declared. And number three, sticking with that subject of conflicts of interest, I would really clamp down on the physician societies. I would say that any physician society is not allowed to accept anything more than $50 a year. Yes, $50 every single year. Whether we're talking about a general medical society, a surgical society, a pediatric society, that is a new rule. Let's see how things change very quickly after that. And on that note, I would also ban all pharmaceutical advertising in the United States. No way. It's out of control. I know a lot of people who come into the USA from Europe, other countries, and they are shocked with what they see when they turn on the television. Only the USA and New Zealand, of all countries, bit strange that one, but USA and New Zealand are the only countries where this is allowed. So ban that completely. That could be done very quickly with leadership from the top, if it was ever desired. Of course, that's unlikely to happen anytime soon, but we have to keep speaking with a clear voice. So those are some suggestions then on how we can change this abysmal situation so that people like Dana White, people like myself, don't have the points of view that we do. We regard doctors with extreme suspicion. We think they are basically legalized drug pushers and they don't understand true health and well-being. Maybe the pendulum will swing back in the next few years. Who knows? Human history is full of examples of pendulums swinging back and forth. And a pendulum which has swung too far to the badness can equally come back to the goodness. All it takes is for good people to keep speaking up, and ultimately change will come from you, the patient, when you say enough is enough and things need to change. Thanks everyone for watching. Feel free to comment down below. Let me know your thoughts. Check out my health programs and my free downloads. Those links are down below. Hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again very soon.